Assalamu alaikum everybody, and welcome to the Medseas, where education meets excellence. Today we'll be learning about a disease that is so common that it affects every 1 in 4 people over the age of 65. As you already know from the title of the video, we're talking about diabetes mellitus. Some of the key aspects that we're going to be discussing here are the causes, some of the types of diabetes mellitus, the mechanism of development of both of these types of diabetes mellitus. We will also go over the mechanism of diabetic ketoacidosis and some of the other effects of diabetes, mainly those which occur on carbs, lipids, and proteins. So what exactly is diabetes mellitus? It is a syndrome of impaired carbohydrate, fat, and protein metabolism, which occurs mainly because of two main causes. The first one is the lack of insulin secretion, as you can see over here, and the other is insulin resistance. Okay? Now, what does insulin resistance mean? It is the decreased sensitivity of the tissues to insulin. We'll come back to this later, and I will explain to you how this definition makes sense. So let's first try to recall what insulin is doing in our body, right? So insulin is a hormone which helps in the uptake of glucose from the blood and its storage in peripheral tissues. This means that it has a vital role in the conversion of glucose to glycogen. Now, when there is a lack of insulin, that means that the efficient uptake of glucose is not occurring. And since that is not happening, so resultantly, the utilization of glucose by the cells of the body has also stopped, except the brain, obviously, because the brain will always utilize glucose. As a result of all of this, the blood glucose concentration rises, and since the cell utilization of glucose is not occurring and it has shifted to fat and protein utilization, we can clearly see that the metabolism of all the food stuff gets altered. This takes us back to our main point, that diabetes mellitus is a syndrome of impaired carbohydrate, fat, and protein metabolism due to either a lack of insulin secretion or insulin resistance, or both of these. So let's talk about the types of diabetes mellitus. There's insulin dependent or type 1 diabetes, and then there's non-insulin dependent or type 2 diabetes. There's also gestational diabetes, but we're not going to talk about that at the moment. So talking about type 1, it is not that common. Only 5 to 10% of the people who present with diabetes have this condition. It has an early onset. It can actually happen at any age, even in adulthood, but usually it has an onset at the age of 40 years. That's why it's also called juvenile diabetes mellitus. Then we talk about how it develops. It develops abruptly over the period of days or weeks. Okay, so some of the causes of type 1 diabetes would be, since this is the kind of diabetes in which there is a lack of insulin secretion, right? So the pathogenesis or the mechanism behind it should be something related to decreasing the synthesis of insulin, right? So it can be injury to beta cells of the pancreas. Now this can occur in certain viral infections, in certain autoimmune disorders, or it might even be hereditary. Then there another cause can be the diseases that impair insulin production. Yani they are going to be causing hypoinsulinemia. So this point about hypoinsulinemia, I'm going to be discussing in a while. First, let's discuss type 2 diabetes. Now, this is a kind of diabetes which is really common. So if a patient presents to you with diabetes, it is most likely diabetes mellitus, but this has a late onset, usually after 30 years, because it is a progressive disorder and it develops over time. So that's why it's also called adult onset diabetes. However, recently, because of all the dietary changes, people under 20 years have also been diagnosed with type 2 diabetes mellitus. Now, this is the kind of diabetes which is more often as a result of insulin resistance rather than lack of insulin secretion. Obesity is a huge risk factor for this, and in this case there will be hyperinsulinemia. Now I'm going to explain to you why insulin dependent type 1 diabetes has hypoinsulinemia, whereas non-insulin dependent type 2 diabetes mellitus has hyperinsulinemia. The type 1 method, it's easy, right? Hypoinsulinemia is because the body is not producing enough insulin, so obviously there is a lag, and hence the blood has low insulin levels, resulting in hyperinsulinemia. But in type 2 diabetes, what happens? There is insulin resistance, right? So there is insensitivity of the target tissues, and as a compensatory response to that, the plasma insulin concentration rises, and this results in hyperinsulinemia. So in simple words, the body is producing insulin, however the desired effect of insulin is not occurring. So the body tends to increase its production of insulin, so to bring about the desired effect. Because of that, there are high levels of insulin in the blood. Okay, so these are some of the key differences between both of these types. Now we're going to move on to some of the other factors which can also lead to type 2 diabetes. So here I've created a list which I've basically divided into 3 parts. The first one, which is in white, you can see here. These are some of the syndromes or diseases which result in type 2 diabetes. So there is a metabolic syndrome, there is Cushing syndrome, acromegaly, the polycystic ovarian disease, lipodystrophy, and hemochromatosis. Metabolic syndrome basically comprises of obesity, there's fasting, hyperglycemia, lots of lipid abnormalities like increased triglycerides and decreased HDL. There's hypertension as well sometimes, and many cardiovascular diseases and injury to the vital organs. So all of these together make up the metabolic syndrome, and insulin resistance is a key part of this syndrome. Therefore, it usually almost always leads to type 2 diabetes. Then we talk about Cushing syndrome. Cushing syndrome is, again, a syndrome in which there's high levels of glucocorticoids. Acromegaly has increased levels of growth hormone. In the polycystic ovarian syndrome, there is insulin resistance and hyperinsulinemia in almost 80% of the women who are basically having PCOS. If it stays for long, then it is a huge risk for diabetes mellitus. In lipodystrophy, there's increased amounts of lipids in the liver, and in hemochromatosis, there's tissue iron accumulation. So these are some of the diseases which, if a person has, he has an increased risk of developing type 2 diabetes. Moreover, there are some mutations as well which might lead to type 2 diabetes. A person might have an insulin receptor mutation. Because of this, obviously there might be autoantibodies against the receptor. So there would be no receptor for the insulin to bind, and it will result in insulin resistance. Likewise, there is the mutation of PPAR gamma receptors. These are peroxisome proliferators, activator receptor gamma. There might be mutations against the melanocortin receptor. These are mutations which result in obesity, and obesity we know is a huge risk factor for development of type 2 diabetes. Apart from these, there's also a physiological condition which results in type 2 diabetes, and I've already mentioned it. It causes gestational diabetes, so pregnancy. Okay, so now let's talk about the developmental mechanism of diabetes mellitus. So what's happening in the body? The insulin levels are low. The peripheral tissues cannot utilize glucose now. So the plasma glucose levels are going to rise. They rise so high that they're almost between 300 to 1200 milligrams per 100 ml. So this high level of glucose in the blood causes loss of glucose in the urine. It causes dehydration, and it causes tissue injury. All of these things are very damaging to the body, but we have to find out how is this happening because of high blood glucose levels. So there's loss of glucose in the urine, right? Now, basically, the blood glucose levels are very high. More glucose filters into the renal tubule right over here. So more glucose will get filtered in the glomerulus. Lots of glucose is flowing through the tubule. And when it comes into the collecting duct, since there's a lot of glucose present over here, therefore water also follows. Now there is a blood threshold for glucose appearance in the urine, and that is 180 milligrams per 100 ml. This means that if the blood has more than 100 milligrams of glucose present in it, only then will the glucose be found in the urine, only then will it be lost in the urine. So we all know that the patients of diabetes, they present with thirst and increased urination, and that is because they are dehydrated. How does high blood glucose level result in dehydration? There are two mechanisms for this. There is direct cellular effect and osmotic diuresis. So there's high blood glucose over here. You can see this vessel here, okay? And the amount of water is lesser. However, in these surrounding cells, the amounts of glucose here are lower and the amount of water here is high. So what happens, since there is a high osmotic pressure outside the cell, the water moves out of the cell, and this water starts going inside the vessels. Since it is moving out of the cell and into the vessel, the cells get dehydrated. Okay, so now how does osmotic diuresis occur? So we know that there's a lot of glucose that is being lost in the urine. The water follows the glucose which is being lost. So a lot of water is being excreted out along with the glucose. Resultantly, what the vessels, they're losing water. So this water which is present in the vessels is being excreted out into the tubule, right? So the amount of water in the vessels becomes less, and to compensate this, these cells which were surrounding the blood vessels, they release their water, and this water from the intracellular fluid basically enters into the extracellular fluid and hence into the vessels. So ultimately what's happening is that these cells are becoming dehydrated. Prolonged poorly controlled blood glucose results in the blood vessels function being abnormal. It causes them to work abnormally and function abnormally in different tissues. They undergo structural changes, and because of these structural changes, for example, we're talking about atherosclerosis here. There is a lot of local injury on the vessels. Those vessels tend to develop atheromas, and these atheromas are a structural change that is occurring in the vessel, and that causes stenosis of the vessels. So what's happening, that there are structural changes in the blood vessels, and these ultimately result in an inadequate blood supply, and because of this there is not only an increased risk of heart attack, there is an increased risk of stroke, an increased risk of end-stage kidney disease, and there might be changes in the eye, for example blindness or retinopathies. Then there might also be gangrenes of the limbs. Furthermore, when we're talking about nervous damage, so chronically high glucose levels, they also cause nerve damage, and this can result in peripheral neuropathy or ANS dysfunction, and this can result in impaired CVS reflexes or impaired bladder control, decreased sensation in the extremities, and there might also be symptoms of peripheral nerve damage. Other than that, the renin-angiotensin-aldosterone axis might get disturbed and result in hypertension, or there might be impaired lipid metabolism, which results ultimately in atherosclerosis. So all of these different things are happening because of high glucose concentration in the blood. So let's talk about the other effects of diabetes. So basically there is a shift from carbohydrate to fat metabolism, and this releases keto acids into the plasma more quickly than they're oxidized by the tissue cells. In keto acids we can talk about acetoacetic acid, and there's beta hydroxybutyrate. So basically the patient develops severe metabolic acidosis because the plasma acidity increases as a result of increased keto acids. This metabolic acidosis, when it is coupled with dehydration, which we have just talked about, results in severe acidosis, and this leads to diabetic coma and death unless the condition is treated by large amounts of insulin. Not only is there increased fat utilization and metabolic acidosis, but there is also increased protein utilization, and they are stored less. So because of that, the body's protein starts to deplete, and if this condition is untreated, there is severe wasting of the body tissue, and this results in rapid weight loss. There's asthenia, which means there's lack of energy. There's polyphagia, and if this stays like this, then over a few weeks, the person can even die. Okay, so it's time to test how much you guys have understood. I have a question for you guys. and that is, okay, what is the mechanism of diabetic ketoacidosis? You guys can pause the video right here and think about it. After that, we will discuss it together. Okay, so let's start from the beginning. There is a lack of insulin, or there is insulin resistance, and because of this, the liver mobilizes glycogen to glucose. As a result, there's hyperglycemia. Now, hyperglycemia was causing a few things, as we discussed in the very beginning of this video. We talked about how there was osmotic diuresis and how there was a direct cellular effect, both of which were resulting in dehydration. On the other hand, we also discussed that insulin resistance and lack of insulin resulted in the shift of metabolism from carbohydrates to fats. Because of this, there was an increased utilization of fats, there was an increased breakdown of fats into fatty acids and glycerol. Those fatty acids were then metabolized to ketone bodies, which were acetoacetic acid and beta hydroxybutyrate. These were then thrown into the circulation, and because of this, the pH of the circulation became lower and resulted in metabolic acidosis. Now, I told you guys that dehydration coupled with metabolic acidosis becomes diabetic ketoacidosis. So that brings us to the end of the video. Hope you liked it and, more importantly, understood it. If you did, don't forget to like this video, share it with your friends, and subscribe if you haven't already. There's a part 2 to this video coming very soon, so stay tuned.